I'm here at the Capitals to discuss the maternal health crisis in Iowa. We have a huge crisis going on right now, and I believe that it needs to come to the forefront. So my name is Dr. Sarah Ledger. I am from Mount Pleasant, Iowa. I practice family medicine with the group there. I've been there about 10 years. I am born and bred in Iowa, grew up just outside of Fairfield on a family farm. People have babies, people need care, mothers need care. The complications, I think, now as opposed to 20 years ago are a lot higher because of our health, the health of moms. And if we can't provide that care locally, they're going to have to travel further and further, and that's a burden when you're in a crisis. And if you're on the verge of delivering a baby, you don't want to have to drive an hour away to deliver that baby. I believe that the prenatal care is very important when it comes to maternal health. And we have a lot of socioeconomical situations such as violence, such as they can't afford food. They can't afford to go to the doctor. They don't have a means to travel to another city for prenatal care. So some of these women are getting no prenatal care. They're showing up in ERs ready to deliver their babies because there's nowhere local for them to go to get their prenatal care. These women come in, we have no idea what the potential complications are going to be. We have it increases the cost of healthcare overall because we're not prepared for we haven't taught these moms how to take care of their babies. We haven't taught these moms how to take care of their bodies, and you see more complications with that, and that's a huge problem. And then who's going to take care of these moms and babies after they deliver? We need to make sure that we have an adequate amount of physicians, non-physician providers that can handle newborn care and maternal health postpartum. There can be a lot of complications postpartum that need to be monitored. And if these women come in and deliver their babies and then leave and have no postpartum care, things are going to go unnoticed, and it's a dire situation. I do have patients that don't have vehicles, okay? So if they don't have a vehicle, they're going to rely on somebody else for transportation. In fact, I had a patient that she would have to call a taxi. The car seat did not fit into the taxi properly. She's trying to bring this child in a taxi to my office for well child visits, non-restrained, because there's no option for her. And that's a problem. The critical access hospitals are the smaller hospitals, critical, 25-bed hospital. A lot of these critical access hospitals started out having OB units, and now those OB units are closing. And that is having a huge impact on maternal health in Iowa. When I was doing OB, I may spend 3 days laboring a patient. I get paid the same amount. You abandon OB to keep your hospital open. That's the choice that you have. Do you want a hospital or not? We're running into the same thing with our EMS services. We run into the same thing with some of our inpatient care units. You have to cut back on the services that you provide to keep your hospital open. And we're seeing hospitals that are still closing. And that's a huge problem. We need more support with our critical access hospitals. We need more money. Unfortunately, we need higher reimbursement. We need support. We can't do it without that reimbursement. We pay a lot of money to these private MCOs, and we are getting less and less reimbursement from them on the physician provider side.